The surgery was exactly what I needed.
Gastric sleeve procedure, relatively common procedure to help patients with weight loss. She lost around 100 pounds. In addition to undergoing a breast lift, I redid her arm lift or brachioplasty with liposuction. I really find that if patients retain some weight in the arms, it's very important to deflate the arms first before removing the excessive skin. This surgery combines nicely with work on the breast and the bra line to really improve the whole upper torso appearance.
In a million years, I never thought that I would have any sort of plastic surgery ever. Once losing the weight and seeing that I had kept the weight off for about 7 years before I decided to do anything, I realized that it was just another part of finishing the process, helping me to feel like I really did lose the weight and I've kept it off. Once I did decide to do that, talked to some people who had had it done, and some people said it was extremely painful. Some people said it wasn't so painful, but I had decided for me that I needed to do this to complete the journey. The surgery was exactly what I needed to make me feel more comfortable, the skin that was left after losing all that weight. It completely brought the journey all the way around to the end, basically. It made me feel like I really did it. With all the excess skin after losing the weight, yes, I did that, and it was great that I lost all that weight. Everything that was left after losing the weight still made you feel like you didn't quite make it. The surgery made me feel like I made it 100%.